Have you ever felt that your mind is working against you? The door is locked, but the mind says, check it once more. Hands are clean, but a voice from inside says, no, wash them again, or something bad will happen. You know it's useless, but still you do it, again and again, every day, every time. Maybe you're thinking, am I going crazy? No, you're not crazy, but it's possible your mind is lying to you. Obsessive-compulsive disorder is not a simple habit. It's an invisible trap whose gate lies inside your own mind. A glitch that makes you repeat the same thought, the same action again and again, so much that sometimes it feels like you're drifting away from yourself. People take OCD as a joke. I'm totally OCD. Everything must be in line. But they don't know. OCD is not a cleanliness craze. It's a psychological attack where every intrusive thought is a mental trigger and every compulsion, a tiring attempt to control that trigger. A patient once said about this condition, it's a thief of time. It steals the peace of every day. And the most dangerous thing, OCD makes you do things that you don't want to do, but are forced to do. But the pain doesn't end there. The real struggle begins when the world chooses to judge you instead of understanding you, when your pain is seen as a quirk and you start dissolving within. But here's a good thing. This condition is treatable. If understood in time, this glitch of the mind can be rewired again. Hello everyone. My name is Dr. Syeda Quadri, and I am a psychiatrist. I have been working in this field for the past 15 years. In today's video, we'll talk about what OCD is, how it happens, and how it can be treated without any unnecessary stress. We'll also understand what causes lie behind OCD, so you can understand your mental and emotional triggers and learn to handle them. If you or someone you know has symptoms of OCD, then this video will help in understanding and treating it. So let's begin and understand. What is OCD? 1. What is OCD? OCD is not just a craze for cleanliness or keeping things in line, it is a serious mental health condition. It includes two things: obsessive thoughts, meaning such negative, scary, or unwanted thoughts that come to mind repeatedly. Even if you want to, you cannot ignore them. Compulsive actions, meaning those tasks or rituals that you do again and again, only to reduce the anxiety in your mind. For example, if someone feels their hands are dirty, and because of that something bad might happen, then that person will wash hands again and again, even if they've already washed them 10 times. Or after locking the door, they will still check 4 to 5 times. Did I leave it open? In OCD, the problem is not in doing things. The problem is the feeling that if you don't do them, something bad will happen. And this mindset traps you in an endless loop. Now let's understand what its causes are. 2. Causes of OCD. OCD occurs due to a combination of several factors. Genetics. If someone in your family has OCD, you might also have it. Brain structure. Some research suggests that in people with OCD, there are differences in specific areas of the brain that are related to behavior and emotional processing. Environment, trauma, stress, or life changes can also trigger OCD, especially if you are genetically predisposed. It's difficult to understand the exact causes of OCD, but these factors help explain why some people get it and others don't. Now let's learn about its effective treatment. 3. Effective treatment methods for OCD. Cognitive behavioral therapy. This therapy is very effective, especially exposure and response prevention. In this, you face your fears without performing the compulsive behavior. This retrains your brain. Medications. OCD can't always be treated by therapy alone. Sometimes doctors also recommend medicine. But remember, medicines should only be taken when prescribed by a qualified psychiatrist or doctor. Every body is different, so dosage and duration are also decided by the doctor. Taking or stopping medicine on your own can be harmful for your health. Mindfulness. This technique helps you manage anxiety without compulsions. In OCD treatment, a combination of therapy and medication works best for long-term relief. There are also some natural treatments that can provide relief from OCD. 4. Lifestyle changes that support treatment. For example, exercise. Regular physical activity helps reduce anxiety and improves mood. Sleep. Good sleep regulates your brain and reduces stress. Healthy habits, eating well, Doing yoga and pursuing hobbies are helpful for mental health. These lifestyle changes, along with treatment, help you manage OCD. OCD is an emotional war, which you fight every day against your own mind. But remember, you are not alone in this battle, and most importantly, this fight can be won. If you or someone close to you is going through OCD, then don't feel ashamed. Courage is what's needed. Courage to talk to a professional. Courage to prioritize your mental health. And courage to begin your healing journey. Like this video if you found this content valuable. And share in the comments. What new insight did you gain from today's video? Until then, take care of yourself and remember, your recovery is possible, and you are not alone in this journey.